Babies who are coughing and popping off, if they're latching on and their letdown is just not manageable, that is a tension pattern.
Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jamie, doula, international board certified lactation consultant and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in. Today, I am joined by Meghan Beames. She is a craniosacral therapist in Canada, and she will be sharing all of her wisdom about how you can know if your baby is struggling with tension and how craniosacral therapy can help. Meghan, I am so glad you are here today. I am so excited to talk to everybody about body work and exactly what it is you do, how it can help breastfeeding. As a lactation consultant and as a mom, one of the biggest tools I use is body work with my clients. And I don't do it myself, but I do refer them to people who can do that, who are skilled in that. And I really think it's such an important tool. And a lot of times when I'm working locally with people, I'm looking for chiropractors that integrate craniosacral therapy. So I'm definitely going to be asking all the questions about the differences, what it is that you do, what you teach parents, what parents should know about body work, and how it can help breastfeeding. So can you just tell everybody a little bit about you, what you do, and start sharing your wisdom?
Amazing. Well, thank you so much for having me on your show. First of all, I'm Meghan Beames. I'm a registered massage therapist. So I live in Canada. So up here, we call ourselves registered massage therapists. So if you're in the States, LMT. I do craniosacral therapy. I mainly work on infants, but I also work on children. I work on teens, adults, usually pregnant, postpartum, and I also teach. So I instruct people on how to do infant craniosacral therapy, and they're usually healthcare practitioners or allied health professionals. So people who are speech language therapists, they could be occupational therapists. I just had a chiro in my class last week. Amazing. Lots of physical therapists do this type of work as well. And I would say half of our students are lactation consultants.
Oh,
So
wow.
yeah, it really draws in the people who are already working with babies, who already are noticing tension patterns and, babies who are just struggling in their own bodies. So they're seeing it in real time and they want to be able to help, with they know they can help in some way. They just don't know how. So they want to learn those ways of helping that baby in that very moment, which is absolutely possible.
Yeah, I love that. I love to hear how this is something that is accessible to so many different provider types. So parents can hear it's not just one type of person. Like there's different people that can incorporate this into their skill set. It's not like you don't have to just go out looking for a baby craniosacral therapist because sometimes that can be really hard to find. So somebody who's incorporated that into their skill set overall.
Yeah. And I would even say that getting someone who has previous experience or previous training in another modality is important because cranio is wonderful. It is beautiful, but it's not everything. That's what I say. It is not everything. It's going to help you. It's going to help give your baby the foundation to work on the skills that they need. So it's going to it's almost like giving it a clean slate.
Mm-hmm.
But you have a clean slate. Now what are you going to do with it? You have to do the exercises. You have to do the oral exercises. You have to do the movement. You have to do the emotional regulation. There's so much more than just cranio.
I always
So,
say it's like a whole bunch of puzzle pieces that have to come together, and you don't have the box to show you the picture, what the picture's supposed to look like.
oh, that gives me a visceral reaction.
Yeah,
Oh, because I need the box, you know?
absolutely. The same. But that's how it feels to be a new mom. I
Yeah.
think is like you know what you think it's supposed to look like, right? You were told
Yeah.
it's supposed to be natural, and then you have all these challenges, and you don't know how to put the puzzle pieces together. So You mentioned tension patterns. What is it that parents can see that might red flag them that their baby could benefit from body work?
So babies who turn their head to one side more than the other, it doesn't even have to be they only turn their head to one side. It's just you notice, you're like, huh, I noticed that they usually turn their head more to the one side. That is a tension pattern. Babies who crawl with one leg, that's a tension pattern. Babies who are coughing and popping off, if they're latching on and their letdown is just not manageable, that is a tension pattern literally in their face. And babies who are back arching, that is tension along the posterior side of their body, the back side. We can have babies whose eyes kind of wander. And, usually early on, meaning like the first couple of days or couple of weeks, their eyes are going to wander a little bit. But if that extends into like the second month, there could be some tension again in their face. Other tension patterns would be, let's say, torticollis. So a lot of people are very familiar with that. A lot of people think that's just the neck, though. That can be their whole body. They get this like C shape or banana. They're doing
Yeah.
banana stretch all the time.
Yeah.
That's tension. Yeah, babies who do little sit-ups, who are just constantly going into baby sit-ups, that's tension on the anterior side or the front side of the body. So there are so many little baby-isms, right? Oh, feeding better on one side than the other, right? You have to do cross cradle on this side and then football on the other. That's tension. So there's lots of little I would say, okay, this might be overreaching, but anything that you're like, there's this little thing. Is that a tension pattern? I would
Yeah.
say probably a
No, and
little
I
bit.
hear what you're saying because I tell people, I'm like, even if your baby is feeding really well, odds are they could benefit from some kind of body work because just the process of, you know, being pregnant and we're more sedentary in our daily lives than generations past, right? So our babies are not moving as much in the womb. So they get stuck in positions that can lead to tension patterns. Depending on what their birth experience was like, that can lead to tension patterns. And it might not
Mhm.
always be expressed in these dramatic feeding issues or these dramatic problems. Sometimes it is, but sometimes it's not. Sometimes it's just those little things that your gut is like, is this normal? And everybody's going to tell you it is, but it might just be common.
And what I say is it is common, but it's not optimal, right?
Yes.
And it's normalized, but
Hmm.
it's not optimal, right? Like we can help optimize things even with just really gentle touch, or in what I like to say is like gentle encouragement to be like, I see you're stuck here. What if we help you get out of that, right? Just really gentle. And so Cranio is very gentle. And so I think because it is so gentle, people don't associate gentle with effective. And I would say the absolute opposite is true. The more gentle you are, the more safe this body feels. And the more safe a body feels, the more likely it's able to let go of something that has been protecting them, right? Like that's what tension is it's a protective mechanism. So how do we help them get out of this, stuckness? And the best way to do that is to help them feel really safe.
Yeah, I feel like just talking about it, I can just feel all of my tension points like flaring up just listening to you talk about it.
Mhm. Those are them.
That's so funny. So for parents who are looking for craniosacral therapy and maybe feeling a little hesitant, what do you think some of the you mentioned, they're maybe afraid that it's not effective because it's so gentle. On the flip side, I know there are parents who are just like so afraid that it's going to somehow inadvertently hurt their baby. What wisdom do you have for those parents?
So know the practitioner that you're going to, right? It doesn't matter what modality you're seeking, know the practitioner. Make sure you're getting somebody who you know is going to take care of your baby. So first and foremost, make sure you feel safe with the practitioner and, ask other people who have gone to them what their experience was like so that you can, have an understanding of what you're going into. And second of all, craniosacral is so gentle that the worst, usually, if this person is doing it properly, that's why I'm saying vet before you go. If this person is doing it properly, the worst that can happen is that you don't see a lot of changes because it's so gentle. And I'm going to add on to that it is so gentle and you might not see big changes, but that doesn't mean as soon as a change begins, it doesn't continue. So these changes actually happen over time and gradually they improve. And so what I would say is like, just make sure you like the person you're going to, because you're going to see them a few times. You're going to see them like 5, 6, sometimes 8, depending on, what's going on with your baby, especially if they have reflux. It could be, or, you've got head concerns, head shape concerns. You're going to see this person quite a few times. So you got to make sure you like them.
Yeah, I appreciate that a lot. I think that's so important for any provider that you are seeing, that you vet them and make sure you feel safe with them from pregnancy through postpartum and beyond. And that's something a lot of us are not taught to intuitively do, right? It's like, oh, well, they've got the credentials. I just have to trust them. And it's like, no, you can vet them, ask
Yes.
people. I love all of that. So I know a lot of people that I work with will be like, okay, so I've been doing this body work and that body work and that body work, and they feel like they're trying all these different kinds of body work and they don't know which one they should be sticking with. I know that can
Mhm.
be tricky, and especially with all of the different acronyms out there. I know we have CST for craniosacral therapy, and then we have the CSFT or CFT for the
Mhm.
craniosacral fascial therapy. What is the
Mhm.
difference between the two modalities, and what should parents be looking for when they're making that decision?
So because I haven't taken the CFT training, I can't actually speak on the differences. I can only speak on what people have told me. So
Okay.
the people who have taken a CFT class or are CFT trained and then they come take my classes, I can speak on that. And so they're really not a whole lot different. They're incredibly similar, in fact, especially in comparison to the courses that I provide. What I've been told is that the person who created CFT said that fascia was kind of forgotten in the CST world. And I would say no. In fact, the majority of my courses are like, okay, what is the fascia doing? What are we're listening to the fascia. And there's a lot of similarities. Um, Perhaps the differences, again, from what I've been told, is that the just the way the practitioner thinks about the body as they're working with it. With CFT, they're listening to the fascia and the cerebrospinal fluid, or just the fluid movement of the body. And then with CST, we are listening to all aspects of the body and we're waiting for this baby to show us that what we're doing is working. What one person said was, instead of going by the book of like, this should be like this, should be like that, CST, or the way I teach it, is we are going with the intuitive nature of the baby and the intuitive nature of the session. So it's, again, same, but different. I might get a little pushback on this, but when I train people, I don't want them to train, or I don't want them to treat a baby through scream crying. I want them to feel, again, as safe as possible. There is very little healing when a baby is in fear, but then I also teach my students to use their professional opinion in the moment and say, well, does this sound like a fear cry, or does this sound like an emotional release cry? And use in that moment, okay, this baby is actually leaning into me as they're screaming. They are looking to me for comfort. I feel it's okay to continue through this crying. Whereas I've been told, again, I didn't take the training, is that that is an emotional release and that's okay to treat through that. And I think that's another, just same, but very different.
I really like that. I've heard a lot of different things. So, and I haven't taken either training. So I try and keep my opinions on that kind of open, but, curious, but concerned maybe about differences. And I've heard similar. And I think it's always important for parents and providers to just kind of have that intuitive guide, right? To always follow the baby. Like, I'm baby led everything, right? From baby led weaning to baby led latching, like baby led everything. So definitely following that. And I appreciate how you differentiate between those two different types of cries. Like, not all crying is necessarily bad. but it doesn't mean we ignore it either. So kind of finding that balance, I think, is so important. And I think that's important for parents to hear as well, because they can kind of start to understand how to listen to that intuition as well, instead of being thrown into an automatic stress response because their baby's crying, which is so natural and normal. They're trying to communicate something. We need to listen to them. As far as working with tongue-tied babies, a lot of times what we see is oral dysfunction, and body work is a critical part of that treatment. Like, it is very, very important. A lot of my clients do get very skeptical about how important that is, because they kind of feel like they're being, sent everywhere. And the thing is, we have a whole baby, a whole body to treat here. And so we need different specialists to do that well. So from the craniosacral therapist perspective, what is the benefit of craniosacral therapy on oral motor dysfunction?
I mentioned earlier that we want to create an optimal foundation, right? And this is a great extension into your question of like, they're seeing all of these therapists, they're doing all of these things. What is working? What's not working? Well, first of all, we want to make sure that you are working with a body that is functioning optimally. So if this body is, first of all, working well, then we can do the exercises. If you are working on a body that is not working well because the brain can't even send signals to the muscles that you're working on, then you're not going to get great results. And so CST actually helps to open up these nerve pathways so that when you do the stimulation, right, oral stimulation, when you do the motor exercises, when we're testing reflexes, we want to have the most well-functioning nerves, and CST can do that. So these tension patterns, I was saying that you can have tension patterns in your face, right? And a lot of people will, they'll say, oh, their jaw is tight, their cheeks are tight, their lips are tight, their tongue is tight. And that could actually be because of cranial nerve dysfunction and tension in that fascia. So CST sits very quietly, right? So we just, gently touch that skin and we tune into that fascia. We tune into whether it's moving or not. And then, as I said, we gently encourage it to move. We gently encourage it to take on a different position. And when it does that, we might be able to actually release the cranial bones as well. Because not only are, the tissues tight, so too are the cranial bones. The cranial bones can actually be overlapping and pinching off nerves. And this is where you get cranial nerve dysfunction. So cranial nerve dysfunction means that you have a tongue that it is not tied, it is not tethered, but it doesn't work, right? And it's like, but why? And it's usually because cranial nerve dysfunction. If you find those areas, we release them, and then you can do the exercises.
I try to explain with a lot of my clients the reason we look at, we're looking at how their reflexes are firing, because I tell parents the baby's reflexes are all designed for them to be able to feed. That's every reflex they have is designed for them to be able to feed. So if there's one reflex that's not firing well, that's a sign that something is going on and needs to be addressed. And it may be related to ties, it may not. Is the tension causing the nerve compression? Is the nerve compression causing the tension? Like, that's not my specialty, but I know it's what we need to kind of uncover, right? So that's when I'll refer them out. But it's always so amazing to start peeling that back and start looking at that. They're like, well, my baby doesn't suck. And I'm like, okay, well, their palate, the spot where they're supposed to be triggered to suck, their palate is overlapping. There's probably a reason. Like, we feel this, intense ridge there. This is probably a thing that we need body work for. I can't solve this. I can give you other techniques to help, but to kind of like crutch our way through it. But that's not solving the root cause. And the first time I was actually exposed to craniosacral therapy as a lactation consultant was a patient went to a craniosacral therapist for the palate, and they did work inside the mouth that just, it was amazing. The turnaround, just addressing the palate, and there was still a tie, but we were able to work with it.
Yeah.
And I am pro release in a lot of situations, but never without making sure we've addressed the tension patterns first, because
Mhm.
I don't want to send somebody into a release that's not going to work because we didn't address the tension. I don't want to send
Mhm.
somebody into a release that they didn't need because it was just tension. And
Yeah.
I think a lot of parents get so worried about release, but then they're also worried about body work. And so kind of helping them understand that body work is a step to either optimizing or preventing release can be so important.
Yeah. And there's a line that I get from parents where they're like, "Oh, you're my last resort." And I want to say, I should have been your first resort. I should have been first. But we're not educated. Our parents are not educated to know that birth is traumatic and birth creates feeding issues, that we can address within the first 24 hours. 24 hours. If you see a lactation consultant and a craniosacral therapist when your baby is 24 hours old, it will help you avoid so many things. I'm not saying forever and ever always. I'm saying it will help you avoid some things. There are still going to be things that will show up, like reflux, like tongue tie that really does need a cut. But it's going to help it's going to help with really painful latch, also a really sleepy baby. It's going to be really helpful for that to, those babies who are failure to thrive. They're not failure to thrive. They're trying to thrive, right? They're really, really trying. They
No,
can't.
maybe I will get pushback for saying this because it's probably not well documented in the medical world, but I think so much of these failure to thrive babies really are fight or flight babies. And what do you
Mhm.
do when you're in fight or flight? You don't eat. Like you don't properly process what you are eating. And we talk about connection. I remember in nursing school, we were taught like, oh, babies who are failure to thrive need to be held more, blah, 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 because they need connection. And it's like, so then why aren't we going down that path more? And we're trying to completely pathologize it. Like, yes, there are so many different things it could be, but why are we completely neglecting the nervous system?
Yes, exactly. Yeah, shutdown is a real thing. And these people who are saying their baby is lazy, hang on, wait a second. Your baby's not lazy. They're trying to survive. They're really, really working really hard. This is their 100%.
Yeah,
Like,
the term lazy baby drives me insane. And I feel like I have to use it in some of my stuff because that's the terms parents are using and searching for. So it helps kind of get their attention. But I hate that word lazy baby because it makes it sound like a willful like defiance.
yeah.
And
Mhm.
it's just we go back to those reflexes. Like I said, every reflex is geared toward your baby feeding. And the only reflexes most parents are taught about is like the startle reflex or the rooting reflex, and everything else just doesn't matter. A lot of my clients will be like, well, my pediatrician never checked all of these reflexes. Why are you checking all of these things that the pediatrician didn't look at? And I was like, I can't answer that for you. I can't tell you why they didn't check that, but I can tell you why I am and what it's telling me about your baby.
Mhm. And it's telling me this, 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 and this. Can we do something about it?
Yeah, exactly. Exactly. It's very rare that I work with a baby who is struggling to feed, a mom that is in excruciating pain, and there's not at least one reflex that's not firing. And you probably know this well. If there's one, there's usually a couple.
Oh, there's usually a lot. And right, we've got reflexes on both sides of the mouth too, right? Or both sides of the face. The reflex on the right is not firing, but the reflex on the left is. And you're like, well, it is, but in comparison to the one that's not firing, it's working. But on its own, is it really that strong?
Yeah, or have
Right?
you
So
seen the
again,
opposite? Because I've seen a few times with babies where it almost seems like one reflex is not firing at all and the other one is over firing. Like it's a
yes,
dramatic
compensation.
response. And that's
Mhm.
the same thing. They're like, "Oh, well, it's really good on that side." And I'm like, "It's a little too good on that side."
Nerve dysfunction can create hypotonicity or hypertonicity. So it can create laxity or overworking muscles, right? So both are cranial nerve dysfunction.
And as parents, there's so much that we're learning. And so anybody who's listening, I don't want you to think like, "Oh God, now I need to become a reflex expert." But
No, no, no. You just got to
that's
stick your finger in your baby's
why
mouth.
exactly. Like that's why we have these experts here. That's why I bring on experts to talk to you. That's why I'm sharing this information so that you can see these signs and be like, hey, my instincts are telling me something. This person said something. Let's go to the person who can help me dig deeper. So, if parents are struggling with this, what resources do you have? What do you recommend they do? Is there anything they can do at home themselves if they don't have a craniosacral therapist near them, or they is it all or nothing? How do we kind of navigate those layers?
When parents don't have anyone around, because that one is a tough one. Um, and so what I would say is touch your baby, talk to your baby, and ask them questions. How are you feeling? What are you feeling in your body? Where should I put my hand? Right. And you might get like a little, your hand might just suddenly go somewhere, and you like, I didn't put it there. It felt like it was pulled there. That's your intuition. Trust your intuition. And then when you're there, be as soft as you possibly can. Like, I'm talking pretend touching, right? Like, that is how soft you are. And just move your hand like clockwise and counterclockwise, just to see the skin moving a little bit. And what that's going to do is it's going to tap into that fascia. It's going to encourage it to move and change. And probably your baby's going to have a great nap after. If your baby has a really great nap after, usually it means you did something. Okay. And so now you did one spot. So the next day, be like, okay, well, where, or, after that nap, ask, where's the next place I can work? And again, just skin to skin touching, your hand on their skin, touching and gently, clockwise, counterclockwise. You're not pushing in. You're not, you're not digging into muscle. You're just moving the skin. That's going to be really, really helpful. There are lots of different like oral exercises. Honestly, there are a lot of accounts that can show you different ways to like stimulate your baby's face. You could do face massage, just the same hand technique as I was saying earlier, really, really gentle, really soft, and just like softly caressing your baby's face. The other thing you can do is just palm your baby's face, just like palm it like a basketball. And again, do clockwise and counterclockwise, just with their skin. You're going to notice a change. You're going to notice a change. Probably their head shape might change in the next few days too. You could palm their scalp. You could palm their neck and just do clockwise and counterclockwise. You do it for 30 seconds, you're going to make change. You're going to see a difference.
And I think that's so important for parents to hear is it doesn't have to be this big dramatic thing. It can be simple. It can be, if you do have a professional near you, they're probably the way to go. But if
Yes.
you don't have that, there's still things that we can do to help regulate that nervous system, to help make that improvement. I think we live in a world that is really telling parents that they're not the experts on their baby. So letting them have a way to feel like they're being hands-on and contributing, even if they're still seeing a craniosacral therapist, because I imagine, and this is just my experience working with craniosacral therapists, is I was told exactly that with my baby. It was like, between sessions, touch them this way, do this between our sessions. So they're still going to be guided to do these things so that they feel like they are part of this process.
Yeah, and home care is very important. I would say that I do 50% of the work and you do the other 50, because there's only so much we can do in a session. And because neural pathways in the brain are formed with repetition. So if they're not repeating this motion a couple of times a day, then they're not going to create really strong neural pathways and new habit forming, right? So that's why the home care is really important. And it's essentially, what we're doing for home care is essentially just reflex integration, which is really important for motor development, for brain development, everything really.
I think movement is really important with babies. And for some reason, we've got this instinct to like keep them as still as possible. And I wouldn't even say it's an instinct. I think it's a taught belief that we have to just kind of like swaddle them down, keep them still, strap them in. And we forget that they are fragile, but they're not as fragile as we think. And that movement can be so good for them. A lot of the clients I work with, their babies' hips will be so tight. And that's the first thing I'm like, let's just move them a little bit. Let's see how they're doing. Just move. Let's see how they're moving. And it'll be so funny because even just right there, like I'm not doing anything technical. I'm just moving their hips to see what they're doing. And you can see it's like tight a couple times. And then we do it a couple more times and we see more movement. And they're like, what? And I'm like, it's just movement. We just need to help them move so they can learn to move.
Yeah. And it's also showing them how they can move their body. Maybe they haven't had that opportunity, and we are laying down the motor pathways for them. They're like that they can then do motor planning, right? We are showing them how to do these movements that they didn't even know they had access to before. And that's okay. We are allowed to show our babies how to move their bodies. That's another point. A lot of parents are told, don't worry, your baby's going to figure it out on their own. They've got reflexes. Well, this whole conversation has been about reflexes that they don't even have access to. So how about we just show them what they can do? And it's okay to show them how to crawl. It's okay to show them how to roll. It's okay to show them how to grab something. We don't have to wait, and everyone's going to do it on their own time. That is by far the truth, but you're not taking something away from them by showing them how to do it.
Yeah, the whole wait and see approach for basically anything, I feel like is kind of just a sneaky way of saying, I don't have the tools to help you figure this out, and I'm not going to send you to anybody who could. Maybe that sounds mean, but I feel like wait and see for anything. And it's the same with latching. It's like they're told to wait and see. Oh, you're in pain, just wait, it'll get better. And it's like, well, if we keep doing the same thing that's not working over and over, how is it going to get better?
Yeah. That was my story. My mom was like, don't worry, the pain's going to go away at 6 weeks. Sure, the pain went away. It did go away at 6 weeks. But my son, on the side that he had the issues with nursing, he also started getting ear infections, recurrent ear infections over and over and over again. And it's like, could have done something about that, could have avoided those ear infections and those multiple rounds of antibiotics, probably.
Yeah.
Just
So
by tugging on his ears a little bit.
is there anything else that you want to leave the listeners right now with? Any words of wisdom? Is anything?
I want to just reiterate the fact that your intuition is very likely correct. Whether it be that you don't think you should go to this professional, you should go to the other professional, listen to that quiet voice. And when I say it's quiet, it's very quiet. So, we've got lots going through our heads, and we're always constantly thinking, what's next? What should I do? Am I doing it right? Blah, blah, blah. Just sit quietly and ask one question. What's the next best thing for me and my baby right now? And trust your intuition. With Cranio, I try to instill intuition in each and every one of the practitioners that I work with, because that will guide them to give your baby exactly what they need in that treatment. Not a prescriptive workflow, but exactly what your baby needs in that moment. And so I want to do the same for you. Help you realize that you actually have the answers. I know you're probably thinking, I don't have the answers. And that might be true, but you have the answer to one question, and that is, what's the next best thing?
I love that. That is really beautiful. Do you have a database for all of the people that you have trained that parents can look and see if there's somebody near them that they can work with?
Absolutely. We have on our website, we have a find a practitioner. You can do a little search if you want, or you
We'll link it in
find.
the show notes.
Yeah. We've got all of our practitioners, including to what level they have completed. We have all the way up to level 4. So those are our very advanced craniosacral therapists. And we even have a certification program. So hopefully you can find someone perhaps within driving distance, maybe.
That's so funny when people say that, because honestly, the area I live in is like nothing's in driving distance.
No, 6 hours. 6 hours is driving distance.
That's so funny. That actually brings up another question for me is, if you do have to travel to get this kind of care, I know some of the concerns that I have with my clients traveling is just, all right, we went and got this amazing work addressing the tension, and then we're going back in a car seat for 2 hours. What kind of advice or wisdom do you have for parents that, like, if this is your only option and you're probably not going to be going as frequently, but you're going and learning things. What can they do to optimize everything after so that it's not just a waste after putting their baby in the car seat?
Yeah. I would say first, the car seat did not create the issues your baby has. The car seat is keeping it persistent. So it will not undo the work that your craniosacral therapist has provided, because you'd have to have a baby in utero and a baby born again to really undo all of the work they did. It might not be as optimal, but if you take like a 15-minute movement break in the middle of a 2-hour drive, your baby's probably going to sleep the entire way, usually after a really good cranio session. But if you get them out halfway through and just move them a little bit, that's totally fine. That will help their bodies to integrate the new changes. The other thing is that if they are sleeping after the treatment, that is when they integrate the new changes. So you do want them to have a really good nap after. That's okay.
That's
That's
really
wonderful.
interesting. I feel like I knew that on a cerebral level, but hearing you put that into words, that makes a lot of sense.
Yeah. Yeah. So it's okay. Quick movement break, 10 minutes, whatever. It's per- totally enough.
I love that. It's still safe. It's still a worthy investment. You're not wasting your time doing that is really
Mhm.
helpful.
Yep. Absolutely.
Oh, well, thank you so much, Megan.
That's my pleasure.
Yeah, this was really insightful. I'm sure there's going to be so many moms who learn so much from it. All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.